people meet, in large numbers, consume alcohol, dance, and what have you. And that has not been addressed. But remember the cigarette lobby was in the first one. The cigarette lobby organized itself, and today it is untouchable.
Mm-hmm.
I think the alcohol lobby has learned a lot from the cigarette lobby. And I think our president is afraid to touch the alcohol lobby, because I had expected at least to say the bottle stores will open from Monday to Thursday. But look, it's still the same thing. Everybody goes into a restaurant, into a party, so what is it? I'm really disappointed with what the president announced yesterday. And I just hope and I pray that God will actually be good to us, so that we don't have, a rampage that you have seen like the likes of India.
Absolutely, I concur with you there. But in the president's defense, Sello, do you not think that he's very concerned about, the economy that would be totally damaged, decimated, and if that does happen, we'll have huge civil unrest in the country? Do you not think that perhaps that is uppermost in his mind?
Look, I've paid interest to the whole question of the economy. Look, there'll always be a price to pay. I think the price to pay in terms of invoking some of the measures that he invoked in the past will not go damage the economy. We are not really talking about closing the economy. We are saying those parts of the economy, small as they are, that lead to the spread of the virus. Let us talk to them and say, for a while, good people, let's do it. Let me give you an example. If you close the bottle stores from you allow them Monday to Thursday, which means the workers there are going to use salary on Friday and Saturday. If you understand what I mean, and even but compare it with what happens when this alcohol is consumed in uncontrolled environments, and it leads to deaths, hundreds or even thousands of deaths. My view is that we need to selectively look at those parts of the economy that have a direct bearing on the escalation of the and talk to the industry. If government needs to support such industries temporarily from its figures, so be it.
Absolutely. Given all the corruption, all our monies that are being stolen anyway. But let's leave it there. Sello, we'll talk to you again. Thank you indeed for your thoughts. Till the next time. God bless.
Have a nice day. Have a nice day.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
With approximately 4 minutes to wrap up time, we have Dr. Angelique Coetzee from SAMA on the line. Morning, welcome to the program. And your thoughts on the president putting us into lockdown level 2. Is it going to make a difference as far as COVID containment is concerned?
Well, it's a step in the right direction. We would love to see the curfew a bit more stricter over weekends. And then still 100 people in the house is still not...
Sounds too much. Sounds too much.
That's too much. It's not really going to help us. And then we're concerned about the taxis, the transport, especially if the taxis are more than 50% occupied. You need to understand that this is a very fast-spreading virus. It's not a very virulent virus, but it's fast-spreading. A lot of younger people under the age of about 40 doesn't really have symptoms. So sitting in a taxi where there's no good ventilation and it's 6 o'clock in the morning, everything is closed, and your mask has not been washed the last few days, might be a problem.
How do we move forward to keep ourselves safe? Because clearly I think we've just become very complacent.
Yes, people did. And even now, what we can see with, again, people under the age of 40 who's been diagnosed with COVID-19, we try to say to them, please, you have to stay at home for 10 days. A lot of them are working for themselves. And because they don't feel sick, they don't want to stay at home. And it's really a struggle. So if you look in the behavior, so it's a behavior problem. if you look at the behavior, we are going to struggle in this third wave to get the numbers down once, you can see it going up, and we are going to struggle because people doesn't really feel sick. They want to go back to work, and they don't want to wear their masks, social distancing, open up.
Okay, looks like Dr. Angelique's line has been cut, but obviously we don't have time to get her back on again, but she has given us some very important information. The issue around complacency, it doesn't mean that, you and your family, if you are together all the time, doesn't necessarily mean that you guys are safe to be together all of the time. Please, even amongst family and friends, close friends, try and exercise all of your social distancing protocols, and that is washing of your hands, masking up, sitting 2 meters apart, etc., etc., etc. That then brings us to the end of the show for today. Thank you indeed for being with me. Till tomorrow morning at the same time as always, please, please, please do stay safe, and do also stand by for the recitation of Juz 19 by Sheikh Tawfiq Ibn As-Sa'ih. Hope I'm pronouncing that correctly. It is exactly 9:59. As always, it is Assalamu alaikum and Khudafiz from me, Julie Ali.